There's something very special and peaceful about being so close to nature. After the hustle and bustle of city life, some may dream of country living. It may seem ideal.
Access to nature, access to natural resources. Oftentimes, there's really close knit communities and families within those.
But a group of researchers suspected psychological challenges of rural living.
We do see disparities in all different kinds of health outcomes for people living in rural areas.
Dr. Emily Willroth is an assistant professor of psychological and brain sciences at Washington University in St. Louis. She's co author of a study focused on psychological differences between city folk and country folk.
The first author on this study is Dr. Olivia Atherton. She's at the University of Houston right now. She's a faculty member there. And also Dr. Marquita Lewis-Thames at Northwestern University. She also contributed a lot of expertise on rural context and urban health disparities.
The research team went into this study aware that rural areas face unique challenges.
Rural areas tend to have less access to high quality health care and mental health services in particular. Just those additional hurdles that someone living in a rural area would need to go to access any kind of healthcare, let alone high quality healthcare or the specific specialists that they might need for their specific health circumstances, as well as limited access to high quality education and cultural resources.
The team wanted to know if these challenges shape the personalities and psychological well being of people living in rural areas. The team used data analysis that combined two nationwide surveys involving 27,000 people.
And both of these follow thousands of adults over the course of 10 to 20 years and map that onto these rural urban codes that tell us, based on the population count, as well as how far the nearest major metro area is.
People who live in more rural areas tended to score higher in levels of neuroticism.
Neuroticism is the tendency to experience negative emotions like depression and anxiety. We also found that people living in rural areas tended to be lower in personality traits called conscientiousness and openness to experiences. Conscientiousness is really tapping into the degree to which someone is really organized, productive, responsible, and that tends to be highly correlated with things like educational attainment and access to socioeconomic resources. And so I think one possibility that we're seeing there is that the limited access that people in rural areas tend to have to these educational resources, cultural resources, mental health care might be leading to those differences in personality that we see.
And Willroth says up to 85% of rural communities have a shortage of mental health professionals, a trend that's only getting worse. Willroth wants to raise awareness about the findings of the study to everyone in big cities and small towns. After all, it's the farmers and ranchers who are major contributors to society.
Agricultural innovations and advancements in terms of their contributions to food production, it can be a relatively isolating profession. For example, the lead author on this study, Dr. Olivia Atherton, she had the opportunity to go to a rural mental health summit recently. And one thing that she learned is that farmers and ranchers often experience mental health challenges as a result of that isolation.
Willroth hopes the study will get people talking and helping one another.
The ways that we can both bring more services and resources to rural communities, increasing conversations, having more conversations about health and about mental health and reducing stigma around those conversations so that as we bring services to these areas, people are utilizing those services and recognizing the benefits of either mental health care or preventative health services, more generally, positive health behaviors.